Hello, everyone. So it's my pleasure to introduce our next panel. I'm an integrative doctor myself, and integrative medicine is my passion, the combination of Eastern and Western, and how we can have really the best of both worlds and really create a situation where we have the ultimate healing. So I have with me today to answer your personal health questions, two of the most prominent and wonderful integrative physicians in the country. We have Dr. Soram Khalsa, and we have Dr. John Puma, who will be joining me on stage and will be literally answering your personal health questions live here right now. Welcome. Yes, well, sure. I'll sit in the middle. That sounds good. So I'll introduce them both briefly and then give them a chance to introduce themselves, because I'm sure they'll put it in their own words much better than I can. But to begin, Dr. Khalsa is a board-certified internal medicine doctor. He's also an associate physician at Cedars-Sinai and on the clinical faculty at UCLA. He's one of the pioneers in functional medicine, which is my passion, so I'll let him tell you about that. And in his practice, he uses phytotherapeutics, homeopathy, acupuncture, and environmental medicine with traditional internal medicine. And we have Dr. John Puma, who's also a board-certified internist, and he's an expert in nutrition and lifestyle and dietary management of obesity and common chronic diseases. He's on a mission to discover the personal medical problems that stop you from looking and feeling your best. And he has a new book coming out the 31st of December, I believe, called Refuel, which is for guys. So thank you both very much for being here, and I'll start with Dr. Khalsa. If you want to just take a moment and tell us a little bit about your philosophy of health, that would be great.
Thank you. Is this working? Oh, there we go. I've been very blessed to be able to be practicing what's now called integrative medicine for over the last 30 years. I started very early realizing that what traditional medicine has isn't quite enough. I have 3 messages for you in my 60 seconds here. Message number 1, remember, health is on a spectrum. Disease is at one end, optimal well-being at the other. Just because you're not sick does not mean you're perfectly well. And that gray zone is organ dysfunction, and that's where functional medicine becomes involved. Number 2, watch your food, eat carefully. More and more people are getting food allergies, gluten sensitivities. And then the other important thing about food is it does not contain vitamin D. Be sure to take vitamin D every day. And my third message is watch the environment. Most of you are ladies. The cosmetics, the facial care products, those are all having endocrine disruptors. We have epidemics of autoimmune disease, epidemics of ADD and autism, which are being increasingly linked to these environmental toxins. I look forward to your questions.
Thank you. Dr. Puma.
My practice focuses on helping men and women make lifestyle changes so that they can prevent and treat chronic diseases, particularly common chronic diseases like diabetes and heart disease, back pain, and the like. My practice philosophy is that a physician is best suited for anyone who does behavioral counseling or tries to change behavior, to coaching patients and trying to provide them both the best information and curating that information, as well as ways to make decisions, whether they're within the traditional, conventional allopathic system or outside of it. My fellowship is in general internal medicine and medical ethics, so I often answer, not just at parties, but also on stage, general medical questions, and we look forward to those today.
Thank you both. So the way that this is going to work is that each of you can come up to this microphone right here and ask your personal health question. You have exactly 1 minute or less to ask your question, so stay clear and stay focused when you ask, and then each of these experts will have also a minute to answer your question based on their philosophy. So I invite you to not be shy. I know you have a personal health question. It can be something simple, it can be something complicated. There's no wrong question. Your question is the right question. So who would like to go first?
There is a timer in front of us flashing red numbers. So we like
go for it. We have our first question. I love it. Please say your first name and ask your question.
Good afternoon. My name is Edmund.
Edmund?
Edmund.
That's part of the question, I think.
For the past year, I've got some sort of I think, allergic reaction to food, some type of foods. I have no idea what. I guess maybe that's just a symptom of getting older. For the most part, what it does, I think when I have wine, maybe 2 glasses of wine, or if I have certain spicy food that might have cayenne pepper, I'm assuming that might be the case. For whatever reason, I've gone to dermatologists, I've asked primary care doctors, and none of them have been able to quite pinpoint what the root cause of it is. I've changed my diet.
What are your symptoms, please?
What it is, I get kind of a irritation, kind of an itchiness up on my forehead, and then the natural kind of allergic reaction a little bit, and also sometimes oddly, like my knee, if I'm having 2 glasses of wine, right on my knee begins to itch, and then when I have water, 2 or 3 glasses of water, it goes away.
All right, that's 1 minute. Thank you. Let's hear what they each have to say. Dr. Puma, do you want to start?
Next question.
No, that's not allowed.
It's fairly common to have a histamine response to red wine in particular. And of course, cayenne pepper and chilies cause vasodilation, redness, sweating, and the like. The way wine is made is actually kind of a secret. There's a whole natural wine movement that doesn't allow any additives in wine. But wine can include everything from the B vitamins and C vitamins, in addition to isinglass, which is fish bladder. So people who are allergic to fish or shellfish may have an allergic reaction to wine if that stays in the wine. To casein, which is a milk protein, and more additives that are common allergens. And it would not surprise me if one of these common allergens was in the wine that you were drinking. I've had patients who've had similar reactions. And so the way to test that is to find a wine that is natural. There's a woman named Alice Ferrer, Fehrer, that writes about natural wine and its development. I would chase down her blog, find the wines that she recommends, and try those instead.
That's a great response. Thank you. And Dr. Khalsa?
I would say all the things that John said about histamines. Red wines are very high in histamine, and also other chemicals which you could begin to react to, like sulfites sometimes. But the other deeper question is, how's the rest of your intestinal system? Could you be having a leaky gut, meaning that you have increased permeability of your small intestine, and or could you be having a general dysbiosis, meaning the ratio of your friendly bacteria to unfriendly bacteria that then leads to your metabolizing food in a different way? So those are questions, and that's how I would approach taking care of you.
Awesome, thank you. Okay, who's next? Do not be shy. Please, stand up. Oh, sorry, and then you'll be right after. Thank you.
Yes, I represent the older generation, but I'm glad I'm here. Can you hear me? Okay, I have a 2-part question. I've lost some weight, but it seems like it's coming back, and I'm really worried about it, that my weight is like I'm not able to control it. I'm wondering and I've been on weight programs, I've talked to nutritionists. I mean, I know what I'm supposed to do, but somehow I'm not doing it well, and I wonder if you have any suggestions about that. And then the other part of the question is having problems with sleeping. I seem to wake up in the middle of the night, and somehow if I eat something, I go back to sleep easily, and I drink the tea to put you to sleep. I forget the name of the tea, rather than taking a sleeping pill, rather than taking a tranquilizer. And I'm wondering, maybe I should be taking something else and not drinking the tea in the middle of the night. Do you have any suggestions?
Next question.
Thank you. No.
I'm really sorry to hear your difficulties both losing weight and sleeping. I assume that the weight loss that you've undertaken is volitional. You're trying to lose weight. And actually doing it with food is probably the best way to do it, more than with exercise or sleep or stress management, although all three can help. The things that help sleep hygiene, that is going to sleep promptly, are things that you probably already know. A dark room that's quiet, that's cool, less than 65 degrees, not having pets in the room or pets in the bed, having the bed designated for just sleep or for sleep and sex, and not having other activities in bed, watching TV or eating, and not having caffeine after 2 in the afternoon or alcohol at night. Those are the sort of basic hygiene things about sleep that improve sleep over time. People who don't sleep well often aren't able to lose weight. This is even more true in men who are unable to make adequate testosterone if they sleep less than 6 hours per night. So which is the only time that men actually make testosterone. So for you, what I would recommend is seeing a sleep specialist, because often weight and sleep interfere with one another, and you want to make sure you don't have sleep apnea, where you're not breathing, where you stop breathing at night, where you snore, where you can't get enough air to your lungs and brain.
Okay,
so
I
I
have
would
to
start
cut
with a
you
sleep
off.
specialist.
Thank you. Dr. Khalsa.
Additional things. The sleep apnea question is very important given your weight, and that can easily be measured at a sleep lab. Additionally, food sensitivities, not necessarily allergies, are a huge cause for not being able to lose weight. And there are specific blood tests now where you can get tested for food sensitivities, and I've seen remarkable results in my practice by following that. In addition, really need to evaluate your exercise and the balance of what your foods are, and a dietitian could do that. But that ties in with your sleep problem. I think you said you wake up at 3 a.m., which in Chinese medicine is the liver time. And as we get older, a lot of people's liver begins to weaken, not get sick, but weaken. And acupuncture can be very helpful for sleep by supporting the liver meridian. People are able to, with mid-cycle insomnia, are able to sleep much better.
Thank you both. That was great. Our next question. I'm going to keep rolling. Here we go.
Hi, how are you?
Good.
I have a coworker that her nails are lifting, and I have a picture of it. She asked me if I could ask you, she went to a dermatologist that said it was psoriasis arthritis. I don't know if that's accurate or not. She hasn't gone any further. They recommended that she goes to a rheumatoid doctor of some sort. So what exactly is psoriasis arthritis?
Well,
Great question.
psoriasis is a skin disease with flaking and thickening of the skin. Psoriatic arthritis is a second condition that some people with psoriasis get. But majority of people with psoriasis do not have psoriatic arthritis. Lifting of her fingernails with psoriasis, just the rash, the skin condition does do that. You don't have to have arthritis associated with it. Does she have joint pains?
Yeah, she said her hands have been really hurting
Okay, so
her.
then she may have psoriatic arthritis. So a proper diagnosis is necessary. Psoriasis can very often respond again to liver support, and also looking at food sensitivities. Also, very importantly, looking at that intestinal permeability problem that I mentioned, also called leaky gut. And it's a hard condition to treat consistently, but often it can be responsive to the proper measures.
And what would those measures be?
Diet.
Diet.
Going towards more an anti-inflammatory diet, looking at food allergies, checking for leaky gut, making sure that it's repaired, documenting before and after that it's repaired. Also looking again at bowel dysbiosis by doing stool tests and seeing what her flora are and helping to balance those and make sure there's no abnormal organisms, which are very common now in our society.
Okay, thank you.
Dr. Puma.
If she has psoriatic arthritis, she actually does need to see a rheumatologist, if for no other reason than to get radiographs and proper diagnosis, because that's a really destructive arthritis that destroys joints and has other untoward immune effects as well. There are anti-inflammatory agents that are prescription that can alleviate discomfort, at least in the short term, as she works on some of the alternative and integrative approaches that Soram suggests. An anti-inflammatory diet does often help people with rheumatoid arthritis. Interestingly, the best data are for a vegan diet, but you have to be really strict about it, and most people are not. This is a place where conventional medicine really does help because it can say kind of precisely what the problem is and offer what is often helpful, at least short-term support, while you look for other support that's broader based and longer term.
Great question. Thank you. Yeah, please. I know.
Hi.
We need a short mic and a tall mic
This is
today.
good. This works.
We have all sorts of heights happening.
This is a great question for all of you. And Robin, maybe you even want to chime in. I have had a number of health issues over the years and have never gone to an allopathic doctor. Have always done either natural remedies or nutrition or gone to an ND. And primarily, I've done energy healing or energy medicine. I know there's a number of modalities that could be classified as energy medicine, and we won't go into that. We'll just call it energy medicine. I'm asking this question of you two, if you've had patients or clients that you've worked with who have followed your protocol but have also practiced energy medicine and have come back to you and you've been like blown away by the transformation. I've seen a natural path consistently and taken the supplements and gotten treatments, but then I take the information that he's given me and I take it to my energy medicine practitioner and I've gone back to him and he's like, wow, what are you doing? You know, you've cured your hypothyroid, and these have all been proven with blood tests. So I'm curious what your experience has as practitioners who are very well known and have amazing clientele, they're very educated. Have you had these experiences with energy medicine where you've seen major transformations, in addition to your protocols, of course?
Great question. Dr. Khalsa.
Very good question. It's hard to say because I actually refer some of my patients to energy medicine physicians or practitioners, I guess is a better word. And I really believe in energy medicine, and I use homeopathy a lot, which is pure energy medicine. But modalities like laying on of hands and so on, I refer my patients with difficult problems to those people. So I don't really have a lot of I've never seen this before, just because I'm like integrally involved in that very thing. But there's certainly a lot of power to energy medicine, and I think the modality isn't as important as the practitioner. And you can't just say, oh, I went to a homeopath. There are a lot of bad homeopaths out there. So the practitioner and their particular dedication and their training and their perspective is critical when you're doing energy medicine.
Great. Thank you.
I think whatever works for you is great. I haven't seen those sort of transformations in my patients or clientele, but I think healthcare is a big enough umbrella so that it includes all sorts of practitioners and all sorts of potential modalities. And I think anyone who has a cure for hypothyroidism is really onto something. I will say that in young women under the age of 40, iodine deficiency is fairly prevalent, and that's often a problem in hypothyroidism. So those women especially should use iodized salt or sea vegetables to get enough iodine.
Thank you. Really great question. Interesting topic. Please.
You mentioned, doctors, about the epidemic today with autoimmune disease, arthritis, lupus. We talk about celiac, sensitivities, even asthma. And allopathic medicine chooses to treat it mostly with steroids. Steroids become the answer to so many medical problems today. And I just wondered, as integrative physicians, do you find that you use steroids in your practice too, or do you have viable alternatives?
Great question. Dr. Puma, you want to start?
Yes, I use steroids in my practice too, but not generally for the long term. Generally, the best role for steroids in many inflammatory diseases is to help people get through the acute inflammatory stage, and then to shift to modalities that change the underlying cause, if possible, of their disease. And that's really what we're aiming. We're aiming to try to shift the underlying cause instead of simply treating the symptoms or putting a Band-Aid on the problem. There are people who actually do need steroids long term. People with chronic renal failure come to mind, who do very well in controlling their chronic disease with them. And like most medications, their use is very person-specific and condition-specific. So they are a tool in the armamentarium. They're certainly not a solution to all inflammatory or immune system problems.
Thank you.
We do have an epidemic of autoimmune disease. As I mentioned in my introductory comments, I think a huge part of that is the relationship of environmental toxicity affecting our immune system. Where these chemicals, whether they're phthalates or whether they're heavy metals or whether they're solvents, our body recognizes them as foreign and makes antibodies to get rid of it, which is a good thing. You try to get rid of a phthalate. But those antibodies, by pure coincidence, if you will, happen to cross-react with human tissues. And that's what autoimmune disease is. Anti-nuclear antibodies, ANA, the hallmark of autoimmune disease, is an antibody that's being made against some chemical, most likely, but it cross-reacts with the nucleus of human cells. As far as treatment, I treat hundreds of patients with autoimmune disease, whether it's lupus or rheumatoid arthritis or scleroderma or multiple sclerosis, and integrative medicine is excellent for those people. And again, things like looking at leaky gut, looking at dysbiosis. I keep saying the same things over and over because our gut is central to our whole health. Looking at activities that are producing and encouraging inflammation instead of discouraging inflammation, detoxification of solvents, metals, and pesticides in a naturopathic sense are very, very helpful for autoimmune disease. And unfortunately, as our environment gets more and more toxic, I think we're just going to be seeing more and more autoimmune disease. And it's very sad because it affects young people even more than older people.
Thank you. Yes, please.
Okay, I'm going to ask separate questions for the two experts here. For Dr. Puma, I know you're working on a book on men's health, and I'd like to ask you what you think about soy, because it's hard if somebody's trying to be vegetarian to get enough protein in their diet. Like, what about soy for men? Because I'm sure you've read a lot about that and what you've been looking at. And then maybe a few tips on what the most important things men can do. And then for you, what about vitamin D? Because I know you've written a book on vitamin D. And in your mind, what's the target level for vitamin D, for a healthy target level for vitamin D? And how many units does it typically take to get a person to that level?
Great
Thanks.
questions. All right.
Thank you. Men and women speak very different languages about food and nutrition. Men generally are unaware that their adipose cells, belly fat cells, convert the testosterone that their testes make into estrogen and shrink their testicles, reduce their muscle mass, and produce fatigue and many of the symptoms that many men experience. Soy has not been shown to contribute to estrogenic levels in men, but highly processed soy that is not fermented can influence certainly the process of thinking about how to eat healthy, and so I don't recommend it. Simple tips are first to eat 50 grams of carbs 2 days in a row, and increase your healthy protein level and increase your fat level, and then keep your carbs to about 150 grams to 200 grams a day through the rest of the week. That 2 days of 50 grams of carbs in our studies has shown a kind of a jump start, just kind of the borderline of ketosis, with people achieving 11 pounds of weight loss in 24 days of doing this just 2 days a week, drinking 3 liters of citrus water daily, or aiming for that amount, and trying not to eat anything they can crush or crumple. This is a guy's approach. And we use resistance exercises that's high intensity intervals for 5 minutes a week, 5 minutes a day for resistance and 5 minutes a day for aerobic. And we teach simple sleep tricks to get to sleep earlier. And it's really been transformative for men.
Great.
Vitamin D, my favorite subject. I'm very passionate about it. That's why I wrote a book. Vitamin D is Mother Nature's anti-inflammatory molecule. We do not get it from food. Mackerel fish is the highest vitamin D food source, and there's only 400 units in one serving of mackerel. The basic dose I recommend for adults who are not tested, blood tested, is 2,000 units a day. The target, and for children from childbirth, 400 units a day, up till 1 year old, go up to 1,000 units a day till their adult weight, and then 2,000. That's without a blood test. The goals in the blood that I recommend are 40 to 70 nanograms per milliliter. Some people now are saying higher, 80 and 90. Our ancestors and lifeguards usually around 70 or 80, so that's probably all we really need for optimum health. Some people need more, like some people need 5 to 10,000 a day to get that level. Some people need less. I have people taking 1,000 a day and their blood test is 70, and that's why I recommend 2,000 units a day without a blood test. And then if you get a blood test, then you can really target and get yourself at an ideal level. Vitamin D is so important. As I said, it's Mother Nature's anti-inflammatory. It helps protect against 17 types of cancer, helps protect against diabetes, juvenile diabetes. Vitamin D in pregnancy is critical. In my pregnant patients, I test their vitamin D every trimester and keep them in that 40 to 70 nanogram per milliliter range.
Thank you. Who's up? Yes?
What would you suggest for constipation?
Great question.
Like severe constipation. And then please don't just tell me to increase fiber, because I've heard it all before.
Fiber works as cement in the body if you don't hydrate it.
That's what I mean. Don't tell me about fiber, because I've heard the cement
You've already
thing.
tried it.
I've heard the cleansing.
Okay.
Fair enough.
Novel for constipation.
So usually you try to figure out for hard to treat cases why, and usually that has to do, it's almost always a bowel related problem, that if there isn't an underlying disorder where you have slow motility, where the intestine doesn't push stuff along, like is commonly the case in advanced diabetes, for example, right, and in some immune disorders as well, then what I try to do is still use food and sometimes use cayenne as a stimulant. There are folks that drink cayenne and lemon water. We're close to Hollywood for a cleanse. I'm not recommending that cleanse, but it is true that if you eat chilies or drink cayenne water, it has a stimulatory effect on the inside of the bowel lining. More water is secreted, or fluid is secreted into the lumen of the intestine. It does hydrate the stool within it and push it through. So it's a simple thing to try, but the longer answer is that we probably need to go through the diet history and figure it out kind of meal by meal.
My answer is constipation is a very common problem. It's a motility disorder of the large intestine. It's not moving things along. And again, that can come from food allergies or food sensitivities, dysbiosis. It can come, a huge factor. Dysbiosis, as I mentioned earlier, is when the bacteria in the gut are not in proper balance. There's not enough friendly bacteria, too many unfriendly bacteria. Another huge contributor to constipation in our society is breathing backwards. What do I mean by that? Your diaphragm goes up when it should go down, and it's going down when it should go up. Our diaphragm in proper breathing, and there's a breathing booth out here at the event today, should be going down when we take a deep breath, yet 99% of my patients do not do that. When we get them on a breathing program that's proper to move the diaphragm massages our intestines to move things along, constipation is often very helped. One other big thing is magnesium deficiency. And there's blood tests to find out if you have a magnesium deficiency, or empirically trying magnesium is a very helpful thing, because magnesium stimulates motility.
Thank you.
The famous milk of magnesia trick.
Right here, you can try it. Yeah, there's an app here called My Breath, and the folks who've created the app that teaches you actually how to breathe properly, so you don't even need to go to a doctor. You can kind of learn just with the app on your iPhone or your Android. Lots of different forms of yoga, Ken, and we're just out of time, but I think to end on that, yes, Ashley, do you want to add something? Okay, we can sneak in one more question. Okay, let's do it. Okay, here you go.
Your toughest patient ever. This spectrum that you started off talking about. So I feel really good, very healthy, everything checks out medically. We hear a lot about breathing, yoga, but primarily meditation. And I, for whatever reason, I read books on it, I talk about it, I go to classes to learn about meditation. I cannot get myself to meditate. How do you deal with a patient who is not, knows something and knows it would be good for them, and in my case, meditation, and knows it's that difference between not being sick, but can help me to that latter part on the spectrum? How do I get there? Just meditate.
Very tough question, Ashley. Toughest question of the day. And that has to do with internal self-motivation and priorities. Some people, their priority is to get up and do aerobic exercise. My priority is to meditate. And so there's no quick answer. You're a fabulous dietitian. You tell somebody not to eat something and they go eat it. How do you motivate them to change? And my feeling is that when it is the right time, you will start to meditate if you keep it in your consciousness.
I have a different answer. The problem is not in motivation. Motivation is a very weak leg to behavior change. The problem is making it easier than not meditating. B.J. Fogg, as a psychologist at Stanford, has an example of flossing one tooth. For those people who don't want to floss, he said, okay, all you got to do is floss one tooth. And the other teeth are right there. So you might actually floss two teeth if what your goal is to floss your teeth. Well, if you meditate for 5 seconds, what I would do is associate that with a particular time, give a trigger, an action, and a reward. So say to yourself, I'm going to meditate for 5 seconds before breakfast. Meditate, count, 1, 2, 3, 4, 5, and then give yourself a reward. Your reward in this case is, I'm awesome. I just meditated. And then the next day, do 5 seconds again. Eventually, you'll figure, you know what? I could do 6 seconds. So you'll do 6 seconds. And your reward then, I'm awesome. I meditated for 20% more time than I did yesterday. Make it the easiest step.
It's a great question, and I think it speaks to also the prior question, constipation. And for my patients, I actually teach them breathing exercises and teach them to meditate, because a lot of what's happening in the gut is connected with what's happening in the mind. So if you can get a hold of the mind, sometimes you can get a hold of your belly too. And it can be really easy, and as easy as Dr. Puma is saying, as counting in for 5, counting out for 5, and if you do it for 10 seconds, 30 seconds, you have won, you have succeeded. I think a lot of people think that they have to sit down for 30 minutes and meditate or to get any benefit, and you can do it for a minute, and I promise you your life will be different. And with that, thank you gentlemen both, thank our experts. It's just been a wonderful session. Thank you all for your questions. They're great questions. I know some of them these guys will be around the event. They have books. If you want to go over to the book table at Barnes & Noble, they'll be doing some book signings. And thank you all for being here, and we'll go right into our next session. Thank you.